Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings, and today I'm going to share with you what I learned at the American Dental Association attending an HPV, what's new basically, and trending in oral health. So this is what you can know as a patient, what you should expect to be discussed from your dentist, your dental hygienist, your OBGYN, your pediatrician, and your primary caregiver. Did you happen to know that most people do not know to get the HPV vaccination for their child age 9 to 15 because it wasn't recommended? And that 70% of people really still do not know that HPV is related to cervical cancer, oropharynngeal cancer, genital warts, anal cancer, and oral cancer. HPV, strain 16, 18. Oh my gosh, we have so much to cover. So let's talk about it now. The cancer risks are rising. HPV related is rising to 34,000 a year. Are you kidding me? But I believe in you. I've been talking about this since 2009, and I can tell you can look back in those videos, it has risen to now 34,000 a year. The HPV vaccination can prevent 92%. Ho, back it up. Yes, HPV vaccination can prevent HPV-related cancers up to 92%. That's something to celebrate. Why are we not talking about it? Yes, it's a sexually transmitted disease, but this is something we can discuss with parents. Have you as a patient had this discussed by your dentist, your dental hygienist, your OBGYN, your pediatrician, or your primary caregiver? We must be advocates for you, the consumer. Know the risk factors, and that is, yes, increase in oral sex partners, an increase in your sexual partners, increase in smoking. So don't be sharing vapes and hookahs and anything like that. This is skin-to-skin contact virus. Now, the CDC recommends that boys and girls between the ages of 9 and 15 specifically get to this. So if it's before age 15, it's 2 doses, 6 to 12 months apart. If it is after age 15, it would be 3 doses on a 1 to 2 and 6 months basis. They have now started what they call is a catch-up type of HPV vaccination, and that is for individuals from 27 to age 45. This is something that's so serious. Oropharyngeal cancer is more popular, yes, in men, and it has now surpassed cervical cancer. This is really important because I think a lot of us gloss over it and say, yes, but we have celebrities who have beat it. And yes, we have. Now let me just give you this one truth. There is not a screening for oropharyngeal cancer. And I'm going to share a photo right here from the CDC. There is no screening for oropharyngeal cancer. So in fact, oropharyngeal cancer will target the soft palate, the side and walls of your throat, and the base of your tongue. So when I say the side and walls of your throat, I mean like the McDonald arches. So it hides back there. It's very difficult to see. So this should be discussed with you as a patient. You should know this. And you should also know the symptoms, and that would be hoarseness in your throat that will not go away, a raspy voice that will not go away. It's very persistent. Maybe even an earache. And we don't think about saying, I've had an earache. Or if you just notice you had a little soreness along the side where your lymph nodes are, and maybe even your lymph nodes are sore. Do you have difficulty swallowing your foods, a beverage, and you've noticed that that's lingered for more than 2 weeks? These are symptoms your dentist, your dental hygienist, your OBGYN, your pediatrician, your primary caregiver must share with you. The good news was that the vaccination number or doses went down. The good news is they're honing in on the value that the dental provider can give to the patient. And the good news is that the HPV vaccination is proven to prevent 92% of HPV related cancers. We are making strides, but we must have the conversation with our healthcare professionals. Until next Wednesday, take what you learn and make a difference with it.